antigen, as you can see, and that also may cause degranulation. Yeah. So what it causes? It causes dilatation of arteriole, vasodilation. Then it increases the permeability of venules. So there is a facilitated transport of fluid across the endothelial membrane. Also, it causes contraction of some smooth muscles. So by binding to the histamine receptors on endothelial cells, all these actions they happen. So the antihistaminic drugs which are given, they are treating the inflammatory reaction by blocking these receptors. Receptor को block कर देंगे because they are congeners, or you may say structural isomers of your histamine, which block the receptors and don't let histamine do its work. I've already given you the example. Urticaria, इसी type का urticaria है. They are red and itchy lesion which are triggered by exposure to anything. Most commonly, we have food protein allergy. Some of you might also be having that by yourself or somebody within the family. You might have heard कि peanuts allergy is very common. Peanut or any food protein, yeast allergy. Some people are allergic to bread. Some people are allergic to cheese. So these are the most offensive, most commonly offensive foods. Few medications, in medicine खाने के बाद इसको rashes हो गए हैं. Might have heard about it. So blood vessels, they open up because vasodilation happens in response to histamine, and the first line treatment for this is antihistaminics. This was H1 receptor, and then there are H2 histamine receptors, which are mainly found in the parietal cells of the gastric mucosa. So because of which, what happens ki peptic ulcer and gastroesophageal reflux disease hota hai. Parietal cells, what do they secrete? They secrete hydrochloric acid, if I'm not wrong, right? So acid reflux happens because of overactivation of these cells, and obviously acid zyada increase ho raha hai to okay. I got a message in the chat. I have not asked for roll numbers, by the way, Neil. I'm not done with my lecture yet. So peptic ulcer happens due to increased HCl concentration within the stomach cavity. The second one is your serotonin, or you may call it hydroxytryptamine. It is a preformed vasoactive mediator, again, just like histamine. The source is platelets. Platelets and a few neuroendocrine cells, such as the ones present in your GI tract. These are vasoconstrictor. So, like I told you, according the requirement. So, histamine is responsible for vasodilation. On the other hand, serotonin is responsible for vasoconstriction during coagulation. So this was all about the preformed mediators. Then you have newly synthesized mediators like your arachidonic acid metabolites, platelet activating factors, your cytokines, reactive oxygen species, nitric oxide, neuropeptides. I'm repeating everything. Okay, I've already enumerated these, but you still need to memorize all of them. So coming back to platelet activating factor, it is a phospholipid or your bilipid layer, as you've studied in your biochemistry. It is phospholipid or a membrane-derived mediator with a broad spectrum of inflammatory effect, platelet activating, because the name itself suggests that it is activating platelets, and platelets are sources of other mediators as well, right? So one factor comes, it causes the platelets to get activated and release whatever they can. So where does this factor come from? So all WBCs, they can secrete them. Most commonly, you see neutrophils, monocytes, basophils, and endothelial cells. Again, platelets themselves also secrete platelet activating factor. So when it is activated, it causes phospholipase 2A2 to function. So it causes vasoconstriction and bronchoconstriction. So it induces vasodilation and causes increased vascular permeability at low concentration. So what they are trying to say is that histamine, though it is a vasodilator, this one is a more potent one and has 100 to 1,000 times higher effect. Okay, so sometimes it also stimulates the synthesis of other mediators, particularly your eicosanoids. Right? So coming to, that was all about platelet activating factor. We'll learn about that later with in detail. Uh, just a second. Okay. Coming back to cytokines. So there are different that are released in acute inflammation, which are very much important, are your tumor necrosis factor, interleukin 1, interleukin 6, and other chemokines. कोविड में आप सबने सुना होगा that IL-6 level कितना आया, CRP कितना आया, D-dimer कितना आया. That's all we talk about all the time to judge the prognosis and the disease activity in the patient. Because COVID-19 is an acute viral illness in general sense. So interleukin 1 has a greatest role in fever. Okay, so still we'll get back. What are the sources of these mediators? Most commonly, they are all your macrophages, the mast cells, activated T lymphocytes, your endothelial cells, epithelial cells, and these are the secretors, the sources of all these cytokines. So what do these have individual effects? Like tumor necrosis factor, it stimulates the expression of endothelial adhesion molecules. All your cellular adhesion molecules which cause the inflammatory effects, your rolling and adhesion you've learned, right? So ECAM, PCAM, as you have seen, endothelial cellular adhesion molecules, then your platelet, this cellular adhesion molecule. These cause aggregation and adhesion of your neutrophils, the inflammatory cells, which will then cross the basement membrane to reach the site of inflammation into the extracellular matrix. You should memorize the picture from Robbins or whatever book you are reading, probably Harsh Mohan. There are nice pictures given in that book. So the adhesion molecules, they are expressed in response to your tumor necrosis factor. It also causes secretion of other cytokines and systemic effects, right? Interleukin 1 has a role in fever, producing it is pyrogenic interleukin, as we know. And IL-6, it has systemic effects of acute, it is an acute phase reactant, just like your CRP. And chemokines, they are responsible for recruitment of more leukocytes at the sites of inflammation and causes migration. The chemotactic factors that we see, that chemical mediator kahin pe secrete hua, तो neutrophils को message मिला कि okay, we have to go here because यहाँ पे दिक्कत हो रही है, right? So these are all interrelated. As you can see, I've just already explained you the COVID infection. SARS-CoV-2 virus is coming to the lung. It is activating the T cells, which are releasing interferon gamma and tumor necrosis factor alpha. Okay. Then other activation are from the dendritic cell, which are releasing tumor necrotic factor alpha. Macrophages are secreting IL-1, 6, and 18. Endothelial cells are also secreting IL-1 in different forms, IL-1 beta, and then there is IL-18. And the fibroblasts are again secreting IL-6 and IL-18, right? So इसमें कौन से responsible है क्या symptom के लिए? So fever is because of your IL-6, TNF alpha. They've forgotten to mention IL-1. IL-1 is majorly responsible for the pyrogenic response, but your interferon gamma, TNF alpha, and IL-6 are equally responsible. Then you have this impaired hepatopoietic function, like the mortality in the second wave of COVID was mostly due to hemorrhagic diathesis, that patients undergoing stroke, sudden coagulation, impairment, everything, sudden internal bleeding. That is all because of interferon gamma and TNF alpha. Next, same that I'm talking about, disseminated intravascular coagulation, when all your fibrin has been utilized in forming the fibrin plugs, but it got dissolved. It did not stabilize. So there is intravascular coagulation. Your fibrin degradation products are everywhere, but they are of no help, right? So then there is decreased serum protein because of interferon gamma. There's hyperlipidemia, liver damage, acute kidney injury. So yeah, after lung, the two most commonly affected organs in COVID are your kidney and liver. And associated anemia is also present. Also, you need to know that hyperglycemia is a another clinical feature of COVID infection, that patients, non-diabetic patients, have a sudden increase in serum glucose, as well as their HbA1c also rises, which is again an indicator of a chronic blood glucose levels. So yes, hyperglycemia stays for a longer period in COVID inflammation. Other chronic inflammation may, these were all markers of your acute ones. In chronic inflammation, you have interleukin 12 released from your dendritic cells and macrophages, which causes production of another cytokine, that is interferon gamma. And this one is released from your natural killer cells and T lymphocytes. These are your direct acting cells. NK cells, they also directly go and kill the cell, which is why their name is natural killer cells. And T lymphocytes, they also have, they don't release antibodies. They directly go and kill the cells, engulf it any way they can. So what the interferon gamma does, it causes activation of macrophages, and this causes increased ability to kill the microbes and the tumor cells. So yes, interferon gamma is also a part of some chemotherapy regimens for particular tumors. Not necessary for you, but just a pearl of wisdom that you must know. Then there is interleukin 17, again released from T lymphocyte. It causes recruitment of more neutrophils and monocyte, which are your first line of defense generally. So TNF and interleukin 1 are very important because their source is macrophage as well as mast cells and endothelial cells. And stimulus can be anything like your microbial products, immune complexes, and products of the T lymphocytes. Their critical role is because they recruit other leukocytes as well by promoting adhesion of leukocytes. As I told you, they cause expression of the cellular adhesion molecules on the endothelium. So because of the expression, the neutrophils, they are attracted towards the endothelium and they can migrate through the vessels into the extracellular matrix. There are 3 pictures here. As you can see, increased expression of adhesion molecules has been shown. The TNF and IL-1 are acting on it, which causes increased permeability of the vessel. So wahan se kya, and endothelial cells are also secreting IL-1 and chemokines. So transmigration of neutrophils across the basement membrane or the endothelium. Again, एक बार पहुंच गया तो वो एक्टिवेशन करेगा, फिर से IL-1 और IL-6 रिलीज करेगा. T cells will also get activated. They will also release interleukins 1, 6, 17 and chemokines. So this is what happens in local inflammation, एक tissue injury हुई है. On the other hand, all these will have systemic effects which are protective in a way. Fever is a protective response. So IL-1, 6 and TNF, they will raise your temperature stability is in your hypothalamus. The areas I will not go into detail. You've already studied in physiology. I hope you have studied. Then, so yeah, you will have fever. In the liver, you will have acute phase proteins like your CRP shall be raised. Your D-dimer shall be raised. And then in the bone marrow, there'll be erythropoiesis and myelopoiesis because you need more defense. So your marrow will have a triggered response that मुझे ज़्यादा neutrophils बनाने हैं because मुझे ज़्यादा soldiers चाहिए. So you will have total leukocyte count raised. So WBC count total is raised. So these are all protective effects. On the other hand, you'll have pathological effects. That is the deterioration of the basic functions like low cardiac output. Then could be thrombosis of vessels, which is again a very common finding in COVID patients. And there will be insulin resistance. Like I told you, HbA1c raise होता है, hyperglycemia भी हो रहा है patients में. So along with that, with hyperglycemia, your beta cells from the pancreas are getting a message that yes, I have to secrete more insulin, but the skeletal muscle is completely resistant. So insulin resistance also is a function. It's a feature. So the antagonic treatment for rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disease again. So as you can see, a joint is being shown in picture A. तो लेफ्ट साइड में देखोगे तो नॉर्मल जॉइंट दिखेगा जिसमें साइनोवायल मेम्ब्रेन है covering the condylar surface on the edges, and there's cartilage. Whereas in a rheumatoid joint, as you can see, the cells are getting activated. All your dendritic cell, macrophage, plasma cell, lymphocyte सब activated. वो क्या करेगा? Secrete करेगा सारे mediators, inflammatory mediators, which will cause hypergranulation of the tissue. Synovial membrane जो है उसका hypertrophy करेगा, cartilage में से भी extra करेगा. So because of, and there will be recruitment of more neutrophils, there will be formation of immune complexes. All this will cause granulation tissue formation. तो joint में space कम हो जाएगा. Mobility will be restricted. So as you can see in the second picture, there is hypertrophied tissue. In the third picture, you can see there are so many cells there. And in the last picture, as you can see, the fibroblasts are arranged in a palisading pattern, which means back to back angulated to each other. I don't know why that has been given in the picture. So yeah, that was all about your mediators. Coming to the chemokines. So chemokines, they are chemoattractants. They are for different subsets of leukocyte. मुझे मालूम है कि मेरे को इसी सेल को अट्रैक्ट करना है. So I'll release a particular chemokine. So that is their role. They have a very specific role. They are not general mediators. So they also activate the leukocyte. So they can be classified into 4 groups, जिसमें से 2 main हैं. One are your CX chemokines and another ones are your CC. So CX ones, they are interleukin 8 and CC are your monocyte chemoattractant protein 1. So they mediate their activities by binding to the G protein couple receptors, which are, and they are 7 in number. So that was all about your chemokines. Then you have most common free radical injury. सारे जितने भी ये supplement, health supplements and your Revital and all that bullshit, this ads that you see on TV, they are all claiming that free radical injury se bachayega aapko ye supplement and all. No, nothing such happens. Okay, you can just decrease it by not trying to harm your body. That's all. Nothing per se prevents it. So yeah, oxygen derived, your free radicals are synthesized by the NADPH oxidase pathway. The sources are again your cells of the first line defense, that is neutrophil and macrophages, and it is stimulated by microbes or immune complexes, cytokines. Triggers सारे inflammatory mediators के एक जैसे ही है. ऐसा नहीं है कि कोई microbe सिर्फ इसको incite करेगा. No, any kind of injury, any kind of harm or harmful stimulus can cause release of all the mediators. You should know this. So microbe है, चाहे immune complex है, चाहे cytokine है, चाहे physical injury है, anything, it can incite the secretion of all your mediators, as well as it can cause your free radical injury. So what phagocytosed microbes? एक बार phagocyte ने microbe को ingest कर लिया, उसको lysosome में डाल दिया. Lysosome is the suicidal bag of the cell. So what will these free radicals do? They will cause the digestion. So it has a microbial or a cytotoxic effect. Okay, but on the other hand, if it is coming to next, nitric oxide, NO, it is a very short-lived, soluble and free radical gas. It is formed by your activated macrophages, and it happens during the oxidation of arginine by the action of enzyme nitric oxide synthase, NOS. So there are 3 isoforms, type 1, 2 and 3. One is neuronal, इसलिए उसको नाम दिया है NNOS, जिसका कोई रोल नहीं है inflammation में particularly. Type 2 INOS is induced cells, whereas type 3 is exclusive to endothelium. As you can see in the picture, there is the nitric oxide ENOS has come to play. It is causing release of nitric oxide from the endothelial cells. Then it is causing reduced leukocyte addition. Should happen. On the other hand, nitric oxide is a vasodilator. So vascular smooth muscle relaxation and vasodilation occurs, and also reduced adhesion will cause the cytotoxic activity within the macrophages. On the other hand, INOS जो है वो काम करेगा, वो microbe को kill करेगा with the help of nitric oxide and free radicals. So as you can see, there is O2 free radical. It is forming a hydroxyl free radical. NO2 release हुआ, and on the other hand, cytotoxic effect is happening on the microbe within the lysosome. So this is all inculcated within. ऐसा नहीं है कि एक टाइम पे एक ही mediator act करेगा. All of them they act together to bring out the solution कि मुझे microbe को kill करना है, tissue damage को minimize करना है, और अगर damage हुआ है तो उसको repair करना है. So as I told you, nitric oxide is a smooth muscle relaxant as well as a vasodilator, which is why people who have migraine usually happens in your early 20s. That's when you start having migraine. So any nitrate releasing food, any high nitrate content food like your chocolates, they can be triggers to headache, especially the migraine type of headache. Then you have antagonism of all stages of platelet activation. Platelet activation से क्या होगा? Cellular adhesion, aggregation and degranulation होता है. तो ये इस फैक्टर को इस प्रोसेस को एंटागोनाइज करता है. Then on the other hand, it also causes reduction of leukocyte recruitment at inflammatory sites. So जो inflammatory mediators बाकी सब ने आके ल्यूकोसाइट को रिक्रूटमेंट करना शुरू किया कि यस इन्फ्लेमेशन करो, यहाँ पे we need a protective response. So post inflammation, nitric oxide comes and says कि भाई तुम्हारा काम खत्म हो गया. So yes, this is how the inflammation it stops or it starts to halt. You will study this with inflammation and you have healing वाले chapter में आप पढ़ोगे tissue repair and healing. Then action as a microbiocidal agent. I've already told you, cytotoxic agent within the lysosome along with your superoxide radicals in activated macrophages. So this table has been given in your Robbins. I will not discuss in detail. You have to read it anyway. This is all वही कहानी है जो मैंने अभी तक आपको बताई. That's all the questions in the chat. You may drop your attendance, and if you have a question, you may tell me. Have you all noted the questions that I have given you within the PPT? It was about enumerate all the chemical mediators, and then it was cell-derived mediators. Ratnam, your question is quite relevant. That yes, they do activate most mediators. They are activators of inflammation. They incite the inflammation, but with decreased secretion. कभी ना कभी तो tissue repair करना पड़ेगा ना. पूरा inflammation cannot go on. If inflammation goes on for long, it becomes a chronic inflammation. That's when your neutrophils and macrophages will lose their role and your lymphocytes and plasma cells will come into play. So what will happen that all your acute phase reactants, like I've told you, interleukin 1, 6 and interleukin 5 for that matter, जो eosinophils को recruit करता है, all these will come and they will activate all your chemoattractant system and everything, cytokine system. But once the microbe has been cleared, or this is just an example of a bacterial infection that I'm giving you. Other than that, once the offensive agent is being cleared, uske baad there is another entire set of interleukins which will come. There are interferons which will come to play, and they will cause decreased secretion of your mediators. This is all given in your Robbins. If you would read, I could not cover it in this lecture, but we will surely cover it in the next one. This is going to be taught to you at a later point. But for now, all you need to understand is the role of mediators in inflammation. How does the inflammation stop is the next one.